So continuing on with some more definitions that for psychosis, hallucinations. Hallucinations are perceptual disturbances of the senses without any external stimuli. They can occur with any of your senses, so you can have auditory, visual, smell, tasting types of hallucinations, tactile hallucinations where you feel things are crawling on your skin. The most common type of hallucination in schizophrenia or our psychotic disorders would be auditory hallucinations. Visual hallucinations are not very common. They're actually pretty rare. And if you ever see someone with smelling, olfactory hallucinations, taste hallucinations, you might want to work them up for a neurological condition because these are also really rare and most likely being caused by some sort of maybe a tumor or a seizure type of thing going on, but you definitely want to work them up medically. Hallucinations are different from illusions, where an illusion is a misinterpretation of an existing sensory stimulus. So we've probably all had an illusion at some point in our life. My favorite example is when you're in a dark house by yourself. You may have thought you saw a shadow, but it ended up being a lamp or something that you just misinterpreted while you were in the dark, and this would be an illusion, as opposed to hallucinations where there's no external stimulus. Illusions have an existing sensory stimulus. All right, so there's a big differential for psychosis. It can be almost anything. It's really important to rule out medical etiology first, especially in anyone who is presenting for the first time ever with psychotic symptoms, delusions, hallucinations, whatever it is. If this is their first time, you make sure that you get all the necessary labs, thyroid panels, vitamins can cause it, delirium can cause it, a bunch of different things. Get a CT of the head or an MRI to rule out any masses that could be pressing on different parts of the brain causing psychosis. Check for substance abuse with a urine toxicology. There's also a bunch of psychiatric disorders that also cause psychosis. So in addition to schizophrenia, there's something called schizophreniform, brief psychotic disorder, schizoaffective, delusional disorder, any type of mood disorder, a major depressive disorder with psychotic features, bipolar disorder type 1, any of these can have psychosis in them. So let's talk a little bit about schizophrenia. Schizophrenia is one of the leading causes of functional impairment worldwide. According to the DSM, there's very specific criteria that need to be met in order to make the diagnosis of schizophrenia. You have to have 2 or more of the following: delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, or negative symptoms. So you need 2 or more of those. Usually it's pretty easy. Most people have, they hear voices plus they have delusions, and then you have your diagnosis. There are a couple examples to the 2 symptoms or more rule. This is if the patient has a bizarre delusion, which bizarre, it means that it couldn't possibly happen in real life. So thinking that an alien is living inside their brain, controlling their every movement, or something bizarre like that, as opposed to non-bizarre delusions where they think that somebody is following them, or they think that their partner is cheating on them, or they have financial problems when they really don't. These are the non-bizarre types of delusions. So keep in mind, if the delusion is bizarre, then they only need that one symptom to qualify for schizophrenia. Or if they hear a voice that comments on their behavior, so it's like a running commentary in their head on every little activity that they're doing, like, okay, she's washing her hands, she's going to get her paper towel, she's putting the paper towel on her hand, she's drying her hands off, she's throwing it in the garbage, something like that. That's all they need to qualify for schizophrenia. Also, if you have 2 or more voices that are conversing with each other in the background, then that's another exception to the rule. So you only need those. The length of duration for the total illness of schizophrenia needs to be for at least 6 months. Really important. This includes the prodromal, the active psychotic phase, and the residual phases of schizophrenia. So there's 3 phases. They don't have to have active psychotic symptoms for 6 months. They have to have the whole thing for 6 months. So it's more lenient. Prodromal phase is when they start to go downhill. Let's say they go to college, and they start becoming withdrawn. They spend a lot of hours in their room. They give up a lot of their activities, hobbies. Their grades start going down, but they're not actively psychotic yet. That's the prodrome. And then eventually it advances to an active psychotic stage that needs to be present for at least 1 month. And that's where they're actually having delusions, hallucinations, and those things during the active psychotic phase. And then the residual phase, when they're coming out of it, they don't have any active psychotic symptoms anymore, but they're still kind of impaired and they're not quite right. Also, in addition, most like a lot of the other criteria, you're going to need significant social, occupational, functional deterioration, and it cannot be due to medical, neurological, or substance-induced disorders. These 2 things are going to be the same for all the psychotic disorders. There's a bunch of different subtypes of schizophrenia: paranoid, disorganized type, catatonic type, undifferentiated type, residual type. Paranoid type has the best prognosis. It's usually a preoccupation with 1 or more delusions. They may or may not have auditory hallucinations with it. You can really follow their thinking, even though they're delusional and what they're thinking is not right. You can follow their train of thought. It makes sense when they're talking to you. You're not having a difficult time understanding what they're saying. This is probably the reason why it's the highest functioning subtype. Usually after you treat these patients, they can hold some sort of job, and they may be able to stay living out in the community or living with their family. And this one also presents at normally an older age. Then the next type is disorganized type. These patients don't really make too much sense when you're trying to talk to them. They have disorganized speech, thought process disorders. Their affect is flat or inappropriate. They might be laughing sometimes at things that are not funny, just strange affect. They're really a poor functioning subtype, and they have a pretty early onset most of the time. Then there's catatonic type, which is really rare. It has a lot of disorganized behaviors, which is the waxy flexibility, where other people can go up to them, move their limbs into various positions, and they'll stay that way. Echolalia, where they repeat. You say something, they repeat it back to you. Catalepsy is defined as indefinitely prolonged maintenance